So what to do in case of adult growth hormone deficiency? Let us leave the attempts of increasing the levels of growth hormone naturally outside the scope of this presentation. Reason being for that, it is simply impossible, and I would say definitely not optimal, to achieve a sure, stable, steady, sufficient and clinically adequate level of growth hormone naturally without use of the growth hormone as a therapeutic pharmaceutical product. Of course, I'm talking about those cases when growth hormone deficiency became clinically evident and is confirmed biochemically. And how to confirm it biochemically, we will talk in a short while. Meanwhile, the simple, straightforward, and most effective solution to growth hormone deficiency is growth hormone replacement therapy, which is done via the regular administration of the HGH products, Ultra HGH being one of them. Ultra HGH is a sterile, white, lyophilized, freeze-dried powder representing the 191 amino acid sequence of human growth hormone produced by recombinant DNA technology. Molecular weight is from 15 to 25 kilodalton. It is 10 international units per vial, which is equal roughly to 4 milligrams. The bioavailability of subcutaneously administered somatotropin is approximately 80 to 90% in both healthy subjects and growth hormone deficient patients. A subcutaneous dose of 0.035 milligram per kilogram of weight of somatotropin results in plasma values of 13 to 35 nanogram per milliliter, and peak plasma level is maintained for 3 to 6 hours respectively. Dosage for the pediatric patients you can see on this table. The dosage is calculated individually depending on the patient's body weight or the surface of the body. In various conditions, either pituitary dwarfism or Turner syndrome or Wheeler-Prader syndrome or chronic renal insufficiency. In patients with adult onset growth hormone deficiency, therapy should start with a dose of 0.3 milligram per day. The dose should be gradually increased according to individual patient's requirements as determined by the IGF-1 concentration in blood. Usually the men dosage is between 0.6 to 0.8 milligram, and for women it's about 0.4 to 0.6 milligram. In international units, the men regular therapeutic dose is somewhere between 2 to 3 IU, and it's about 2 international units for women. However, over the time, women may require higher dose, which can be subsequently gradually increased. In all cases, the treatment goals should be assessed through the IGF serum level. The targeted IGF-1 serum concentration is in the range 250 to 350 nanogram per milliliter for adults up to the age of 60. As for the adults above the age of 60, the slightly lower value of IGF-1 is recommended, which is usually sufficient in the range of about 200 to 250 nanogram per milliliter. Hence, the dose of the growth hormone for the adults above the age of 60 can be even less than regular therapeutic doses for adults with growth hormone deficiency. Obese individuals may require higher dose of growth hormone, which can be established through the serum IGF concentration in each and every case. Basically, the absolutely correct way is to titrate the dose according to the desired IGF-1 serum levels. Usually, growth hormone should be administered subcutaneously, either the entire dose before bedtime, 30 to 60 minutes after the last meal, which preferably should be low-carb, high-protein meal. Or, alternatively, it can be administered in 2 split doses. 1/3 of the daily dose in the morning upon waking up and 2/3 of the daily dose in the night before bedtime.